This is knee osteoarthritis, a condition that gradually damages the protective cartilage inside the knee, leading to pain, stiffness, and difficulty moving. The knee is one of the most important joints in the body. It works like a hinge, helping your leg bend and straighten when you walk. Ligaments, tendons, and muscles around the knee help keep the joint strong, stable, and properly aligned. The ends of the bones inside the knee are covered with a smooth, rubber-like tissue called cartilage. It acts like a cushion, protecting the bones and helping them move smoothly with less friction. Knee osteoarthritis happens when this protective cartilage gradually wears down over time. Aging, excess weight, previous injuries, and repeated stress on the knee can all increase the risk. When severe damage causes ongoing pain and difficulty with daily activities, knee replacement surgery may be recommended. During the procedure, the damaged joint surfaces are removed and replaced with artificial components to help restore movement and reduce pain.